It's Cystic Fibrosis Awareness Month, and there are close to 40,000 children and adults living with the disease in the U.S., a condition that can make conceiving a child difficult. Well, let's welcome back Dr. Jessica McLaughlin, reproductive endocrinologist at Coastal Fertility Specialist, and her patient, Kristen, and her miracle, Ellis. Thank you all for being here. He's making his TV debut. When did he make his debut into the world?
July 2023.
2023. Oh, so you've just been with us for several months now. How's life so far?
I'd say he's soaking it in.
He's soaking it in. He's absolutely precious. He's a beautiful boy.
Oh, thank you.
Tell us a bit about how you discovered that you had cystic fibrosis and what that journey was like to wanting to start a family.
So I was diagnosed when I was 2 days old. So very early diagnosis. So for me personally, I kind of grew up knowing I had cystic fibrosis. Mm-hmm. On that journey, the reality of life expectancy and all of that, I grew up kind of on the cusp and threshold, watching it advance. So,
and what is cystic fibrosis, and what was the experience like for you?
So cystic fibrosis is a genetic disease that mostly impacts the respiratory and digestive systems, but underlying kind of affects the entire body overall, with just the inability to breathe and kind of produces a mucus that stays in the lungs that can therefore lead to infections that are chronic.
And sinus infections are very common, right? And doctor, this is predominantly among the white population, cystic fibrosis diagnoses.
Most commonly.
Most commonly. It can affect other ethnicities as well. So when other patients come to you saying, you know, I've got cystic fibrosis, but I want a family, where does the process begin?
Yeah, and so there's, I think knowing in your heart if you want a family, we just need to assess if you, from a chronic medical, kind of standpoint, if that's, really feasible from a safety standpoint. Mom's health is always number one, and so especially medical conditions like cystic fibrosis that are really affecting the lungs. Pregnancy is just such a condition that really puts a stress on the heart and puts a stress on the lungs, and so sometimes kind of, underlying medical conditions, would become so much worse or exacerbated with pregnancy that the safest thing is for someone else to carry a pregnancy, and that's what's called using a gestational carrier.
And I'm glad that you mentioned the distinction, though, because when you think of cystic fibrosis and you're talking about the lungs and the heart, you don't necessarily equate it to having an effect on your reproductive organs, right?
Yes.
But certainly, as you grow, you need to be able to breathe.
Right.
It does put a strain on your heart anyways, the whole experience of pregnancy. So was that a difficult decision for you to decide to use a gestational carrier?
So when we first kind of had that conversation with my care team, there was a little bit of that let down disappointment kind of.
You wanted the experience of being pregnant?
Yeah. And, in my scenario, actually, some of the newer drugs, the fertility component, they're finding more successful with patients, but I sat on that cusp and threshold where we knew my lungs had a tendency to collapse. I do grow 2 different chronic infections, and so with that, they kind of had the reality that carrying a pregnancy, I would probably see a significant permanent loss in additional lung function, which ties then to life expectancy.
Yeah.
So,
how do you go about choosing someone to carry your baby? Because this is all you. This is all you and your husband, correct?
So that was a whole nother component that when we finally made the decision, we would rather me be around longer to enjoy it. It was totally worth it just to have someone else. We toyed back and forth with using someone we know versus an agency. We ended up with an agency more so because of age, and we had a few people come forward that we knew, but ultimately they had underlying conditions that would have possibly impacted the pregnancy. So,
Is it risky, doctor? I mean, is it risky to choose someone else to carry your baby? And when we're talking about a gestational carrier, we're talking about a surrogate,
A surrogate,
right?
yeah, gestational surrogacy.
So the trust, knowing that they're going to be taking care of themselves, knowing that they're going to give you the baby that you help to contribute to. So what are some of the challenges?
Yeah, so, certainly there's kind of the initial screening process, but then it's really, the doctor's job, and that's one of my jobs, to kind of take over and, kind of let them know that I think this person is a good candidate to be a gestational carrier. So generally they have to be, young, healthy, and have had uncomplicated pregnancies, kind of in the past. So there's a very strict screening process that we use, that both protects, both the gestational carrier and, future baby.
Yes, and this future baby, sweet Ellis. Oh, and he's going to be turning 1 in July, which is just around the corner, so not too long. He's such a ham. He's a natural already. Well, thank you so much for sharing your story with us, and I think it gives a lot of people hope that they don't have to use their diagnoses as a reason not to start a family.
absolutely.
That's wonderful. Well, thank you both so much for coming in. Thank you, Ellis.
Thank you.
We're back after this.